Hello, Representative Howard.
Hello.
Hi. I would like to speak to you about a nurse staffing bill if you have the time.
Of course, please do.
H.R. 2932 is a bill that Congresswoman Jan Schakowsky and Senator Sherrod Brown introduced to Congress on May 4th this year. The bill is called the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act. The bill will set minimum nurse-to-patient staffing requirements for direct care nurses, requires a study of staffing requirements for direct care licensed practice nurses, and will provide whistleblower protection for nurses if they do not feel comfortable with the number of patients they are taking care of.
Why do we need this type of bill?
Well, glad you asked. We need this bill because safe nurse staffing ratios are linked to the patient's safety and satisfaction. It is also important for staff satisfaction. Being overloaded with patients can cause nurses to burn out and become frustrated, and they often leave their work or actually leave the nursing field altogether. Because of healthcare reform, our healthcare networks are trying to make their new budgetary requirements and often look to reducing staff in order to do this. It's important not to reduce the number of nurses to the point that it's not safe.
It is true these days. It is a balancing act for hospitals to make budget with the healthcare reform and the changes that come with it.
I agree, but as a nurse, I also believe it's important to find a balance that works for all. Patient and staff safety are the most important things we should look at. And thank you so much for your time, Representative Howard.
Thank you too.
Cut.